All right, everyone. Hopefully you can hear me. Happy Wednesday, as usual. Our Wednesday live chat. Thank you so much for joining us today, guys. I really do appreciate it. We're starting a little bit earlier today. I do have a video that's going to be coming out today also on cayenne peppers, so I think you guys might find that a little bit interesting, but I wanted to make sure I got started a little bit earlier today on the live stream. The way you guys weren't waiting until like 12:30 or 12:20 or anything after that. We're getting started just a little bit earlier. So as soon as this is done, I already have it edited. Everything's ready to go. Probably be like 30 minutes later, maybe a little bit more. Sometime right after this, we'll get that video up for you guys, and I think you'll find it interesting. And the reason why I'm bringing that up, I think you'll find it interesting because in particular, it has to do with lowering blood pressure. So thank you so much, guys, again, for coming on in. If we can get some where you're from in the chat, I would love to hear it. I love the engagement. So if you guys can let me know where you're listening from, it'd be greatly appreciated. And then we'll make sure that we get into it. But hopefully you guys are having a wonderful Wednesday. Again, I'm really excited for this chat with you guys today. Blood pressure, one of those things with heart disease. I already told you guys before, about 1/3 of the individuals in the whole entire world are going to have some sort of risk factor when it comes to heart disease. So heart disease is going to be affecting 1/3 of the population. All right, and it can be risk factors associated with that as well. And one of the main ones, all right, the two main ones probably being blood pressure and also cholesterol. But blood pressure, high blood pressure is a huge phenomenon that's going on right now. Love you. I love that name. From Dubai. Awesome. See, this is why I love hearing it. Montricia. Hopefully I'm saying that right, Montricia. Good morning to you. From Nigeria, awesome. From Wisconsin, Ronald. See, I love this. People all over the world listening in. Dallas, Texas. Go Cowboys, Michael. Thank you for letting me know. America's team. No, I'm not American, but I am a Cowboys fan. I'll just let that slip out. But yeah, I think today's discussion is really popular, guys. I think it's really important, even more so. We have a lot of videos on the channel that are about blood pressure, foods that we're going to want to eat. The good thing about blood pressure, first and foremost, let's make sure, again, I am not a medical practitioner, but I have done a lot of research on this topic. I've looked at a lot of foods that have to do with this topic. So I'm coming at it from someone who's just had 8+ years of research into heart health. Basically, in almost every single one of my videos, I'll list pretty much a heart healthy health benefit. And blood pressure seems to be a lot of them. I'm coming from the Great White North, Michael. Montana, Teresa, thank you so much for letting me know. Thank you for the engagement, guys. I love it. And for some reason, my thumbs up. For some reason, I can't see the thumbs up. Last time, I wasn't even promoting it. Remember, our goal is always 30. We hit 43 last time, and I couldn't even tell. It was stuck at 7, and you guys just crushed it. So I have to thank you. Everyone on this stream, everyone who's listening after, so much support on that last live stream. Thank you so much, guys. Unfortunately, I won't be able to see. I think it's paused again, but, we love hitting that like button. So thank you so much. But again, like I said, blood pressure, one of those things that's going to affect a great proportion of individuals worldwide. It's not just, a Western thing, something that's happening in one area of the world. It is literally happening all over the world, and we're seeing increases. There's studies that are coming out every single year that's showing that high blood pressure is on the rise. Watching from Saudi Arabia, awesome. I love it. Mel, I hope I'm saying that correctly. I apologize if I'm pronouncing any of the names wrong. Great, Therese. I'm very happy to hear that. Thank you for the comment. I love hearing that. The more we know, I love being able to share this information with you guys. So again, just to sum up, the reason why this is such an important topic, just like arthritis was, just like digestive health was, is because we're seeing studies out there where more and more individuals are now dealing with high blood pressure. And again, high blood pressure is one of the risk factors for heart disease. Okay? One of the biggest ones out there, one of the most common ones out there. The other important thing is that we know, so I already know this, before, high blood pressure was something that people in their late 60s, maybe early 60s, maybe late 50s were dealing with, all right, in their 50s. People a little bit, older. Now we are seeing people literally in their 20s and in their 30s who are dealing with high blood pressure. A lot of that, again, it's a touchy subject, but again, I would be doing you guys a disservice if we didn't bring it up. A lot of it has to do with obesity rates for high blood pressure and our diet. Not getting enough micronutrients, not getting the important heart healthy friendly nutrients. We know what they are, guys. Potassium, magnesium, fiber, all of those important things. All right, so just a diet devoid in heart healthy nutrients. All right, for blood pressure, tons of different things. We could go into nitrates, things that are going to promote vasodilation, all of these things that we're going to be talking about today. But we know high blood pressure is on the rise, and we know that it's on the rise in younger and younger individuals today. So very important to keep in mind, and that's why I wanted to discuss it. Make it its own topic. Heart health is important, but let's break it down a little bit. I always love breaking it down and simplifying it. All right, so if we want to increase the overall health of our heart, obviously, if we're dealing with high blood pressure, we're not going to be able to do that. So if we want to increase heart health, reduce the risk of heart disease, we need to make sure that we're regulating, and if you're dealing with high blood pressure, lowering high blood pressure. All right. And if your blood pressure is good, we want to maintain that. All right. So what are some foods? We'll talk about some foods that are going to be able to achieve that for us. But thank you so much for the engagement. Wow. I love seeing it. All the way from Dubai, Africa, the States, Saudi Arabia. That is just amazing to read. I love reading that, and I love hearing where you guys are from. So let's get right into it. Now, the first thing, I'd be remiss if I didn't bring up one of the important things. We're going to get into foods in pretty much 3 minutes, but I need to give my little kind of spiel at the beginning because this is very important. All right. We already know that obesity rates are driving high blood pressure rates up. So one of the important things, guys, and I mentioned this in a few live streams now, is making sure that we're getting 150, we're shooting for about 150 minutes of movement, okay? It doesn't have to be high strenuous exercise. It can be low to moderate at the most. I'd even call it a low moderate. All right, getting out for a walk, things like that. Making sure that we're getting that movement in. That's going to be important for lowering blood pressure levels, all right, or at least potentially, all right, lowering or helping to lower the risk, all right, because if we're sedentary and we're not getting movement, that's one of the risk factors for high blood pressure, all right, and for obesity. It can help cut down that, all right, two things that are going to be related to high blood pressure. So we need to make sure that we're aiming for that 150 minutes. Again, it doesn't have to be strenuous. It doesn't have to be super intense. 150 minutes of going out for a nice walk. Now that it's getting a little bit warmer, especially here, all right, getting a nice, easy walk in, enjoying the outdoors, going for a hike, things like that. Getting maybe a little resistance training in. Doesn't have to be going to a gym. It can be with resistance bands, super cheap on Amazon. You can get a set of 5 resistance bands, all right, kind of increasing in resistance for about $25, all right? So getting some resistance training if you're wanting to start that. I don't think that's a bad idea. Lots of health benefits to resistance training, which we talked a little bit in our osteoporosis talk. From India, awesome so much, guys. Thank you for letting it come in. I love it. Laya, I hope I'm pronouncing that right. Apologies again if my pronunciation is wrong. But welcome from India. Thank you so much. But again, that resistance training, if we want to start, and you can look at, for resistance training, again, it doesn't have to be 30, 40 minutes of resistance training. You can find a video on YouTube. If you're getting 10 to 15 minutes of resistance training and then maybe going for a 10 to 15 minute walk, you are doing a great job. And if you're doing that for 3-4 times a week, that's all you need. Maybe even 3 times of resistance training, and then the other time can be just a walk. So again, I'd be remiss if I didn't tell you guys, if we want to be regulating and helping to lower high blood pressure, we need some movement in there, guys. Because again, if we're not, we can add in all these foods, but getting this movement in is only going to help the ability of these foods. Again, is doing this, again, another important point. All right, you'll hear any medical practitioner now these days. Trust me, with a lot of my consultations that I'm doing, a lot of the clients I work with, a lot of them come in after hearing from their medical practitioner that they should be getting some exercise in. All right, if they're dealing with high blood pressure. All right, if they're on medications for high blood pressure. All right, because again, I wouldn't work with anyone if they're on medications for high blood pressure. I would have to go and make them go see a doctor before working with them anyway. All right, but again and again and again now. All right, I just saw it on TV yesterday. There was a doctor discussing about heart health and kind of getting into a little bit of gut health. The research isn't as clear on if movement's going to be helping with gut health, but certainly for overall heart health and regulating blood pressure, we can see that 150 minutes is sort of what we want to aim for. Okay, guys? So again, I'd be remiss, I would be doing you guys a disservice if I didn't bring that up. If we only talked about foods, all right? If we're living a sedentary lifestyle without much movement, all right, and we're not getting, those micronutrients in, you can add all of these foods in there, but you're not going to be maximizing your potential of lowering high blood pressure. So just shoot for that 150 minutes, guys. You guys are from a lot of beautiful areas. I'm sure it'd be very nice to get a walk out right now. Maybe go for a hike. Things of that nature. Again, it doesn't have to be strenuous. So we know, all right, as we get into the foods here now, all right, the best foods for lowering high blood pressure or for having the potential for lowering high blood pressure, because let's also keep in mind it can be genetic, all right, and sometimes, all right, we might, as I always say, we might just pull a bad card. We're just we have a predisposition to high blood pressure. All right, we have to deal with that as well, and that's why I always say speak with your medical practitioner. Also, all right, have it right in the title or the description of this live chat. But let's talk about some of the foods that are going to help regulate and lower blood pressure. Again, I think it's very important. All right, the first one, guys, and we can create a little umbrella here. We don't have to go food by food. All right, we can keep it simple. We can sort of simplify it just a little bit today. All right, so let's talk about some of the foods that are going to help lower blood pressure naturally. Okay, because there's some very, very important ones. All right, one of the first ones that I would go with, guys, if we're going to be adding them, and I think these are probably the ones that are going to be the easiest to add to your diet, are going to be berries. All right, you guys have heard me talk so much about blueberries, strawberries, raspberries, all of those important things. All right, Phoenix, Arizona, I love it. Shout out to Phoenix. Thank you, Zeus. But again, the berries, why are berries so important? They just have so many health benefits. Again, blueberries are a true superfood. Again, I always talk about how sometimes those superfood lists get a little bit diluted. You'll see like 70 to 100 foods listed in it, when really I would kind of summarize it as maybe 20 foods maximum that are true superfoods. Blueberries being one of them. Strawberries potentially being the other, but I would say blueberries 100 absolutely are going to be a superfood, and they're going to be one of the best foods to help lower blood pressure. And really any berries, well, maybe not any, but let's talk about an umbrella here. All right, and again, tons of research. This is the best. This is why I love this talk. There's been tons of research. I've read tons of research papers that are discussing certain foods that can help lower high blood pressure. Again, we're going to want to watch obesity. All right, we're going to want to watch our lifestyle. So if we're sedentary, but there's tons of research out there on certain foods that have the ability to lower and regulate high blood pressure. And that's the list I built from, all right, looking at these studies. All right, and also just a little bit with experience. All right, not with myself, but people that I know. Again, it's not my job specifically to prescribe foods to lower someone's high blood pressure, but I can give options to individuals with high blood pressure, foods that are going to help them to lower it. So the first one, guys, would be berries. Lucy, welcome to the chat. Thank you so much for your comment. So the first one would be blueberries, guys. Now, we have an umbrella here, all right? Your best berries, all right, for naturally lowering blood pressure, okay? And I like using the word regulating blood pressure levels, all right? Regulating because you might not have high blood pressure, but you may be able to stabilize and keep blood pressure nice and healthy, all right? If I had to pick two, the best would probably be blueberries 100% and then strawberries being the next one. Okay, those would be the two I think that are the best, and I'll give you the reasons why. All right, we already know that blueberries, but a lot of people don't know about strawberries. They contain a flavonoid antioxidant, guys. I'll mention this in videos. I'll mention it again today because it's super important. Those two berries contain a flavonoid antioxidant known as anthocyanins. All right, that's what gives blueberries its reddish, kind of bluish, like that dark blue, purplish, maybe more so than reddish, purplish blue color. All right, so anything that's purple and blue is going to have those anthocyanins. But the reason why I say people don't really remember strawberries so much containing anthocyanins is because they're red. They don't have that bluish color. They're one of the only non-bluish purple foods. So think like grapes, eggplant, beets, things of that nature. They're high in anthocyanins. But really anything other than that, all right, are fairly low. But strawberries are a great source of anthocyanins, and there's been tons of studies, all right, and large studies. I love the large studies. I remember reading a study on high blood pressure, or we can call that hypertension. You'll also hear it referred to as hypertension, guys, where there was a study of more than 30,000 people. They found that that flavonoid antioxidant, known as anthocyanins, all right, have the ability to reduce the risk of high blood pressure, all right, and lower high blood pressure, all right. And we're talking about at the acute level and the chronic level. So acutely, in a couple of weeks, if you add in blueberries and strawberries into your diet, they found in some of these studies that you're able to lower your blood pressure, all right, within a few weeks. I think it was 6 weeks. Okay, so that's fairly fast, guys. So that's acute. If you're maintaining and eating them over the years, all right, then we can get rid of some of those risk factors that are associated with chronic high blood pressure. And again, the longer that you have it, the higher the risk of high blood pressure. Or sorry, not high blood pressure, of heart disease. Okay, I'll say that again. The longer that we are dealing with high blood pressure, the higher the risk factor for developing heart disease. So blueberries and strawberries, guys, I think those are probably the two simplest. They fit into most diets. They're very versatile. All right. The only one that might give you a little bit of issue is if you're on a keto diet. If you're really strict with keto and you're trying to stay in ketosis 100% of the time, so that means you're eating very few carbs, pretty much no carbs. You even have to watch out for what vegetables you're eating. All right, blueberries, strawberries are going to be one of your best foods that you can have. All right. Now, another thing that you can do, all right, with blueberries, all right, one of the ways, another reason why I love them so much, all right, they're and strawberries, blueberries and strawberries, very micronutrient dense, and they have those heart healthy, high blood pressure friendly micronutrients. So what are those again, guys? The main one is going to be potassium, all right, and the second, probably most important one, is magnesium. So they're a great source of all micronutrients, but they're an awesome source of natural potassium and magnesium. Very heart healthy foods, and it's going to help with high blood pressure levels and regulating those high blood pressure levels. So it can help with lowering blood pressure. Hey, Mac, great to see you in chat again. Thank you so much for joining us on this Wednesday. I really appreciate it. So blueberries and strawberries, guys. Now, not only are they a good source of potassium, magnesium, manganese even, I would throw that in there, but they're also a good source of dietary fiber. And remember, dietary fiber is very important when it comes to overall heart health, and we've seen studies where it can help to regulate and lower blood pressure. Okay, a lot of people don't normally equate fiber with these blueberries and strawberries, different types of fruits. Okay, but blueberries are a great source of dietary fiber. Strawberries, another great source of dietary fiber, both soluble and insoluble. Bananas can be up there too. But again, if we want to talk about the best foods, remember, I don't really buy the 100 foods as a superfood. I like to simplify it. You have blueberries, you have strawberries. If there was one other one, I would throw raspberries in there. These are low-calorie, micronutrient-dense foods that are going to be amazing for lowering blood pressure. The other great thing about these two, remember strawberries and blueberries, is that they're very high in antioxidants, all right? And these antioxidants, they have a very high antioxidant capacity. Blueberries is off the charts when it comes to antioxidants. Strawberries are a pretty close second, all right? Well, not too close. Blueberries are in a league of their own, but strawberries are in second. These antioxidants are going to help with reducing, especially chronic high blood pressure, guys. Remember, we already know a very potent antioxidant, anthocyanins, found in these, all right? So their antioxidant capacity is through the roof. Again, that's going to help with lowering the risk of not only heart disease, but lowering the risk factors of having high blood pressure. Okay, so blueberries and strawberries, guys, a great food choice, very easy, very versatile. One of my favorite things is adding blueberries to oatmeal. You can even add them to smoothies, very easy. Again, frozen is fine. You can eat them frozen. All right, that way you can buy them in bulk, nice and cheap. All right, they last forever, and then you can get them in that way. Same with strawberries. All right, a lot of people, like fresh strawberries. I know they're delicious, but if you want to have smoothies and things like that, and you want them to last, and it's nice on the wallet, buy them frozen. All right. A lot of the times people have to throw away if they buy too much in bulk, things like that. If you're buying them frozen, you don't have to deal with that. Okay. So those are two fruits, two berries that are especially helpful. Some of the best foods that can lower high blood pressure. And I like using the term regulating blood pressure levels. And large studies are showing this. Now, again, I'm not sure. It's funny. It's going to be almost like a surprise to me how many thumbs up we have going on here. Right now, mine is saying 0. Hopefully, some of you are getting a little bit out of this chat, and hopefully there's a few thumbs up there, but I always appreciate that, guys. So let's go on to our next food. So we know blueberries and strawberries are a great one. I think maybe the easiest to add to the diet. All right, but all of these foods are going to be very versatile and easy to add to the diet. All right, so another one, you could add bananas in there. The reason why, and because they have potassium. All right, so bananas are going to be another good one when it comes to specifically lowering blood pressure. Now, why did I separate them from berries? Okay, well, bananas are sort of in a league of their own just in terms of their micronutrient content. Remember, we talked about the micronutrient friendly sort of nutrients when it comes to lowering blood pressure, potassium probably being the most important one. Blueberries are sort of a league of their own when it comes to potassium content. All right, now the reason why I separated it, they are a little bit higher in calories, all right, and they're a little bit higher in GI. So what that means is you are going to get a little bit of blood sugar spikes, all right, and again, blood sugar spikes, insulin spikes, not necessarily the best for overall heart health and for blood pressure, but again, you would have to be eating bananas in a pretty large quantity for it to actually negatively affect your heart. So don't go out there thinking, Foods for Health is saying if you eat bananas, it's going to lead to heart health. Again, you would have to be eating quite a bit of them. All right, but if you're having like a banana a day, you're doing just fine. And again, very, very high in potassium, which is pretty much essential. All right, it's an essential mineral and vital when it comes to regulating blood pressure, hypertension. We can call it whatever we want. All right, so foods that are rich in potassium, I think bananas may be one of the easiest, again, to add to your diet. I love the foods that are super easy to add to your diet. Again, maybe the only one you wouldn't be able to add this one onto is a keto diet. All right, but bananas, very helpful in naturally lowering blood pressure. Again, I would put the berries just a little bit above bananas, but just because of bananas' high potassium levels, all right? And also, don't forget, the more unripe the banana is, the higher the dietary fiber content is. All right, and especially with that super rare fiber, we already know that fiber is going to help regulate blood pressure levels. We talked about this right at the very beginning. A very heart-friendly food, and very friendly when it comes to lowering and regulating blood pressure levels. They're going to have what's called resistant starch. All right, very good fiber for our heart, very good fiber for regulating blood pressure. All right, even if they're more ripe, you're going to get a little bit of resistant starch, not as much. It lowers quite a bit, but you're also going to get a nice fiber called pectin, guys. All right, so bananas are also a nice source of heart-friendly dietary fiber. All right, so bananas are a nice one too. Maybe you guys already knew that one. All right, just because of the potassium levels. All right, that makes it one of the best ones. And there's lots of foods that are high in potassium, but bananas are, I think, are one of the easiest to add. I can't think of a lot of people, myself included, who don't enjoy bananas. All right, so blueberries, strawberries, bananas. Remember I said if I was going to add another one, it'd probably be bananas. Bananas are probably, or maybe raspberries also. All right, those are probably the fruits that you're going to want to go to first when it comes to lowering blood pressure, all right, naturally. And again, you always speak with your medical practitioner, but we see in studies these foods are able to help naturally lower or regulate blood pressure levels. So let's go on to our next one. That's 4 great fruits right there. Remember, you don't need to add all of them, maybe 1 or 2. The berries are a nice choice. The reason why I like the berries is they're super low in calories, super micronutrient dense, and great for lowering blood pressure. Now let's go on to our next food groups here. Remember I talked about those anthocyanins, all right? Those powerful flavonoid antioxidants. Probably one of your other best choices, one of your best foods for naturally lowering blood pressure, all right? And there's been numerous studies on this, all right? One of the best is going to be beets. So if you remember, I said the purple sort of bluish foods out there, beets being included in them, are going to be really good for lowering blood pressure because they have those anthocyanin flavonoid antioxidants. So beets, it doesn't matter if they're boiled, if they're, in a smoothie, just as long as we're eating beets, all right, they're going to be one of the best foods to naturally lower blood pressure levels. All right, so beets are a great, tremendous choice. Also, they're very high in fiber, really high in micronutrients, all right, that are going to help reduce blood pressure. Now, there's a nice thing with beets that we haven't mentioned yet, which blueberries aren't going to quite do. Bananas, strawberries, those fruits that we already listed. All right. What beets are going to promote, and it's because of the nitrates. All right, now don't get it confused. I remember when I was first researching beets, I remember seeing nitrates. Nitrates are there's 2 different types. There's the healthy and the very unhealthy. The very unhealthy tend to be found in, think of your lunch meats or you guys know what I'm talking about, like ham, those quick lunch meats, all right, the processed meats that we want to stay away from, very high in sodium, very high in preservatives, all right, one of them being nitrates. Those aren't the ones we're talking about. Beets have different type of nitrates, the healthy type. Okay, so what we're getting from beets are healthy nitrates, which are going to help keep high blood pressure lower and reducing blood pressure in both short and long term. So acute and long term, which is very important. Remember, the longer we're dealing with high blood pressure, the more and more that risk of developing heart disease becomes. All right, and when it comes to beets, all right, again, I said boiled, but also beet juice is very, very good. All right, now what we see in some studies that drinking I think it was about 1 cup of beet juice. If you were drinking 1 cup of beet juice per day, again, it can be in moderation, all right, that you were seeing a reduction of blood pressure, all right, within a month. So how amazing is that? And, when you think about it, all right, it doesn't matter if you're drinking the beet or eating the beet. So if you're eating the beet, all right, maybe about, again, 1 cup of beets, all right, so maybe something like around 100 grams of beets, all right, you're going to get very, very similar benefits, all right, very similar benefits when it comes to lowering blood pressure. Any fruit restriction for sugar patients? I think when it comes to fruit, I think always keeping fruit in moderation is best. All right. So again, if you're trying to restrict sugar, because we do know that fruit has glucose and fructose being fruit sugar, glucose being natural sugar. But again, monosaccharides, both combined, can create sucralose. I think blueberries, all right, and strawberries are your best choice. And then I would go with raspberries. Okay, you're not going to be getting as much of a blood sugar spike. There's not as much natural sugars in those, and they're high fiber. So that slows down the absorption rate of those sugars, natural sugars, all right, into the bloodstream. Okay, because of their fiber content, all right, it's slowing down the absorption of those natural sugars into the bloodstream. So again, reducing blood sugar spikes, reducing the production of insulin. So again, just keep it in moderation. Blueberries, again, aren't going to give you a huge spike. They're low GI. Strawberries are the same, but just keep it in moderation. And again, speak with your medical practitioner about that as well. All right, but that's what I've seen from most studies. Okay, so drinking beet juice, eating beets, all right, positive effects within a month when it comes to lowering and regulating blood pressure. All right, and acutely, you can already see changes, all right, positive changes within 24 hours, which is just amazing. Is it going to completely lower high blood pressure to lower blood pressure within 24 hours? Absolutely not. All right, but you will start to see benefits within a very short time. All right, sorry about that, guys. Hopefully I didn't blow out your ears on that. Let's keep going here. Mine kind of got blown out. My apologies, guys. My apologies. But let's keep going with foods that lower. Blackberries are equal to blueberries. In some sense, I like blackberries. Are they equal to blueberries? That's a great question, Marilyn. All right, blackberries are a very underrated berry when it comes to overall heart health and even lowering blood pressure and just overall superfood quality. Blackberries are very good. They're not going to have quite the benefits of blueberries, but they will have some of the benefits. I think after raspberries, I would put blackberries up there just because of their antioxidant capacity. They're good levels. They're not as high in potassium. They're not as high in magnesium. All right, they're a good source of it. Don't get me wrong. All right, but their antioxidant capacity, their heart-friendly micronutrients, but also their high levels of fiber. So blackberries are very nice as well. Would I put them on the list or tier of blueberries and strawberries? Maybe not. But again, if you like blackberries, blackberries can be a good choice for you as well. Okay, so we got beets. All right, don't forget the thing that was sort of talking about before I had to kind of mute the mic there for a second. The thing I was talking about for blood pressure, all right, in particularly, is that beets have healthy nitrates, what we call inorganic nitrates. And we've seen in numerous studies how these inorganic nitrates can cause a reduction, all right, or regulation in blood pressure levels. All right, so that's why beets are a tremendous one. I love beets. I think they're one of the best blood pressure friendly foods. Okay, and again, healthy nitrates. Why are those so helpful? Well, they're going to promote vasodilation. All right, which just means the heart doesn't have to work as hard, can help regulate blood pressure. All right, and it's actually going to help with lowering blood pressure, but also help with the promotion and health of your arteries and especially your blood vessels. So we're reducing the risk of atherosclerosis, so the hardening of the arteries and blood vessels, which again is only going to promote the risk of high blood pressure. All right, that's one of the risk factors for it. Again, because if you have hardening of the arteries or hardening of the blood vessels, again, the heart has to work harder. All right, so that's going to be one of the risk factors of having high blood pressure. So getting those inorganic nitrates, tremendously important. Beets are one of the best ones. That's why they've done tons of studies on people who actually work out and athletic performance. They're getting what's called vasodilation. All right, so better circulation. The heart's not having to work as hard. All right, and it's coming from those inorganic nitrates. So vasodilation, tremendously important for blood pressure and for regulating and lowering blood pressure. All right, so let's keep going from here. All right, vasodilation with beets, guys. Let's continue with the other ones here. But Marilyn, yes, blackberries, not quite equal to blueberries, but they can be helpful when it comes to lowering blood pressure. Again, I'd put them on the tier sort of with raspberries. I always like blackberries, raspberries, strawberries, blueberries, things of that nature. All right, let's go on to our next food. All right. Now, you're going to find on this one, maybe you've heard of it, all right, or maybe you've heard the benefits. I know most people have heard of it, but one of the best one, and I think this is a good one, but starting your day off with oatmeal, oats. Oats contain what's called, well, for one, we know that they're high in dietary fiber, both soluble and insoluble fiber. All right, but what oats contain, they contain another special fiber, just sort of like unripe bananas contained resistant starch. Oats or oatmeal contains a type of fiber, very rare, but very heart-friendly, and very friendly when it comes to lowering blood pressure. It's called beta-glucan. All right, and we've seen in studies it has the ability to reduce blood pressure. All right, which is just great. Beta-glucan found in oats. A lot of the studies have to do with cholesterol, but it's also been found that it can help with lowering blood pressure levels as well and regulating blood pressure. All right, and also that's systolic and diastolic blood pressure. All right, so that's just tremendous. I like starting my day off with oatmeal. I won't have it every day. Sometimes I'll add it to my smoothies, things like that. And you're just getting a ton of heart-friendly benefits when it comes to oatmeal. Again, that fiber is one of the best things that you can get for heart health. Soluble, insoluble, and then that important beta-glucan, which you're not going to find in very many other foods, especially, sort of your grains and things of that nature. Now, I think there was a question here. Yes, Ronald, must lose 20 pounds for best BMI to get blood pressure back to normal range and need info. Okay, was that your doctor who said that, Ronald? Now, BMI is an interesting, calculation on the way to do it. BMI is just body mass index. Now, what BMI doesn't take into consideration, a lot of the times BMI will tell you that you're obese or overweight and things like that. But what it doesn't, it might not necessarily be the best indicator for weight is because it doesn't take into any consideration how much muscle mass you have. All right, and everyone has at least a little bit of lean muscle. Okay, so, if you look at overall body composition, BMI isn't going to be looking at that. But yes, Ronald, the one thing, all right, even though it might not be the best indicator, but as we mentioned from before, all right, losing weight, all right, trying to lose weight, staying away from obesity or being overweight is going to give you your best chance of lowering blood pressure as well. Again, if we're overweight, we can add, or obese. Again, it can be a touchy subject, but we need to discuss it, especially when it comes to high blood pressure levels. All right, very important that we discuss it. All right, and a lot of the times doctors will prescribe this. All right, if we're overweight or if we're obese. I'm not saying for you, Ronald, but in general for anyone. All right, if you're obese, again, one of the things that they're going to tell you to do is to lose weight, and that's where my consultations come in with them. Okay, so losing weight, very important. All right, let me know what info you're thinking, Ronald, if it's weight loss or anything like that. Okay, but let's go on to our next one. So I think oatmeal is one of your best one, especially when it comes to different types of grains and things like that, guys. Another thing is, oatmeal, very versatile. the thing is, a lot of people don't like oatmeal by itself, but the best thing is that you can add other heart-friendly, especially blood pressure, all right, foods, lowering foods, regulating foods into the oatmeal, and it's going to make it taste great. Like you can add blueberries into oatmeal. That's tremendous. All right, adding blueberries, even some a little bit of flaxseed and things like that, so you're getting super high fiber. That's a great way to lower and regulate blood pressure. So oatmeal, tremendous. We know it's very heart healthy, and we know that it's going to help lower blood pressure levels. There's been numerous studies on this, all right, especially with the beta-glucan fiber that's found in it. All right, I think what I found, there was like over 25 studies that found that it helped lower blood pressure levels, both systolic and diastolic, all right, which is important to note, all right, for lowering blood pressure. I think the only other one I can remember off the top of my head is barley may contain some beta-glucan. Now we're going to get the no signal sign coming up here, but as always, it's funny, it always seems right when we get to the 40-minute mark, sometimes that tends to happen. I didn't think it was going to happen. I thought we were safe today, but again, throw up a picture of, I'd throw up blueberries or something along those lines, blueberries, strawberries, a nice picture up there for you guys to look at. Remember, we're in I always consider this to be a podcast, so throw that up there, something nice to look at, and then you guys are good to go. But let's keep going. So I think, getting in oatmeal, again, you can add other heart-friendly and blood pressure-friendly foods into there, like blueberries, maybe a couple nuts and seeds, things of that. We'll get into that a little bit more. All right, and you get that beta-glucan. So I think that, and it's very high and it's very underrated when it comes to micronutrient content, when it comes to oatmeal. Very high, great source of many micronutrients, okay? Again, also with oatmeal, and this is why I like starting my day with oatmeal, and maybe, I would recommend it to most people, is that you're not going to, it has so much fiber, you're not going to be getting those crazy blood sugar spikes. Remember, all that's going to do, all right, is make you hungrier, all right, it's going to lead to more insulin being produced, all right, and again, it's slowing down the absorption rate of the carbohydrates that are found in oats and oatmeal, so that fiber is a nice start to the day. All right, nice start to the day, great for digestion, and very good for lowering blood pressure. All right, you guys maybe have heard that before, just because of the great fiber content that's found in oatmeal. So just keep that in mind, guys. Oatmeal, a great complex carbohydrate, which we can add other blood pressure lowering friendly foods into there, like blueberries, even bananas. That's another great choice. Right? And then, some nuts and seeds, which we'll get into a little bit later. But I don't want to let the cat out of the bag quite yet. So let's get some other ones in here. Let's switch it up just a little bit. We talked a lot about some fruits, some complex carbohydrates. We talked about beets being another very nice one with that vasodilation. All right, let's talk about some vegetables, guys. All right, and especially dark leafy green vegetables. Dark leafy green vegetables are a tremendous way to manage and lower high blood pressure. All right, so dark leafy green vegetables. You guys may be able to guess what some of those might be. All right, so my favorite one is probably broccoli. All right, now why broccoli? All right, you guys hear me talk about broccoli all the time. All right, broccoli is probably one of your best dark leafy green vegetables. So broccoli is going to be up there, but that's definitely not the only one. All right, broccoli is going to be a nice one, but there's other ones such as kale, Swiss chard, spinach is very good, cabbage, some of the ones you guys heard me talk about. All right, and any like romaine lettuce is very nice. And the reason for that is we've already touched on nitrates. That's why I brought up beets first. But these dark leafy green vegetables are going to be a great source of nitrates as well. And remember, these nitrates are very important when it comes to lowering blood pressure levels naturally. All right, there's been a ton of studies on there. Even just 1 to 2 servings, like 1 serving of dark leafy green vegetables. And remember, we want to shoot for maybe like 3 to 6 servings of vegetables per day. But just 1 serving, 1 to 2 maybe, of these dark leafy green vegetables, you can see a very, very quick change in blood pressure levels. Again, the acute and chronic, which is very important. Remember, it can start producing a reduction in hypertension or blood pressure levels within 24 hours. All right. Is it going to lower it from, high to normal in 24 hours? Absolutely not. But we already know just with 1 to 2 servings, we're already going to start to see the benefits of the managing of blood pressure. So these dark leafy green vegetables, we already named off a bunch. Broccoli, kale, spinach, lettuce. Don't underestimate romaine lettuce, guys. Cabbage, Swiss chard is a nice one. All right, so tons of dark leafy green vegetables that we can add. Laya, good question. Watermelon definitely is a good one. Absolutely. Mangoes, haven't read too much on that in relation to blood pressure. It might be. I just haven't seen it, but watermelon is certainly one. That's going to be good for blood pressure. So great question. We can get into that a little bit more maybe at the end. But I know watermelon does have blood pressure lowering abilities. So great question. So that's a nice one, guys, too, if you want to write that down. All right, so dark leafy green vegetables, again, not only are they high in nitrates, and again, vasodilation, promoting the health of our blood vessels, our arteries, our heart isn't having to work as hard. That's very important when it comes to lowering and regulating blood pressure. All right, again, dark leafy green vegetables, very versatile. You can add them to, stir fries. You can eat them raw. You can put them into smoothies. I like to do all of those. I'm kind of lucky. I like to eat broccoli raw. I'll put spinach into salads and things like that. Even kale. All right, but again, lightly steamed or put into stews, stir fries, you can do that as well. All right, so again, very versatile. Dark leafy green vegetables, guys. A good one for lowering blood pressure. All right, also sulforaphane in broccoli. That's why I always mention broccoli as maybe being the most important dark leafy green vegetable. It's going to have those sulfur compounds, all right, and very rich in nitrates. Great source of nitrates. Again, we already know vasodilation, how important that is for blood pressure. All right, so excellent. Now, let's talk a little bit about watermelon. Why, off the top of my head, I do know that watermelon contains an important amino acid. All right, I think it's citrulline. All right, citrulline. All right, an amino acid which is going to help manage and regulate high blood pressure levels. Again, it's very similar to beets. All right, very similar to beets. It's going to help with the production of nitric oxide, and then that's going to really give you that vasodilation. All right. Again, it can help lower, I'd say, more mild hypertension levels. All right. And remember, all of these foods are going to help prevent blood pressure as well. So that's something important to keep in mind. But watermelon, I think because of the amino acid citrulline, it kind of stands out from some of the other ones. It has that important amino acid, which is good for lowering blood pressure levels. Okay. So that's why, I'll take just a quick one. It relaxes blood vessels, great for our blood vessels and arteries, all right? Can improve blood flow, things that are all important for blood pressure, all right? So that's why watermelons, that's a nice one, Laya, sorry. I think that's a great choice. Watermelon, maybe not quite, it's a little bit more niche, maybe not quite on the level of the berries that we mentioned and bananas, just because, citrulline is kind of the major reason why you're getting the benefits for lowering blood pressure. But it is a nice one to supplement with because, it's always nice to switch it up, all right? And it is giving you that amino acid, which the other ones aren't, all right? So it can kind of be a nice combination. Right, if you're getting some watermelon in with blueberries for different reasons, it's helping lower blood pressure naturally, or at least regulating and preventing high blood pressure. So watermelon can be a good one. You got citrulline in there, which is very nice amino acid. I think some people may even supplement with it. I'm not 100% sure on that, but it is nice for nitric oxide. And again, that's very, very healthy when it comes to lowering blood pressure. All right, so let's get into some other ones here, guys. We just finished talking about dark leafy green vegetables. Remember, we know that's going to help in the acute and in the chronic levels. So quickly, all right, short term and long term. Again, in the short term, it's not going to overnight lower high blood pressure to normal blood pressure, but it's going to start that process. All right, we can already see that it can start to help reduce hypertension within that short period of time. Maybe not getting us down to the levels that we want or that we need for healthy blood pressure, but again, it's going to help quickly, and it's very effective. And it's got those important nitrates, very similar to beets. Hey, Sonia, good to see you in chat. Thank you so much for coming in. Now, I will mention, I'm not sure what the thumbs are up to, but we're trying to hit that 30. Again, it's kind of fun for me not really knowing. The last time I didn't know, we got it to 43, which was a new record. So it's kind of fun for me not knowing what the thumbs up ratio is. But if we can keep hitting that thumbs up, very appreciated, guys. Thank you so much. And I love the engagement so far. But let's keep going with some friendly blood pressure lowering foods. Now, you guys have heard me talk about when it comes to heart healthy foods, you guys have heard me talk about garlic many times. I think garlic is one of the healthiest heart friendly foods out there. And it's no different when it comes to lowering blood pressure. All right, now, do you have to eat tons and tons of garlic to get its benefits? Absolutely not. All right, don't forget, garlic, all right, has that nice active ingredient, allicin, all right, which, we have seen can help with overall heart health, all right, also help with lowering blood pressure, but also we also see tons of research, again, where garlic can naturally increase the body's production of nitric oxide, which is very, very healthy. All right. Now, again, we've mentioned nitric oxide quite a few times. I talked a little bit about vasodilation, helping blood vessels to relax and not have to work as hard. Same with our arteries. But also, remember, vasodilation, all right, just think of blood vessels dilated, keeping them dilated. And that's why the heart doesn't have to work as hard. And that's why I've mentioned that it can help prevent atherosclerosis. If you're getting that vasodilation or allowing the blood vessels to dilate, again, you're reducing the risk of them hardening, all right? And that's called atherosclerosis, all right? So again, that's going to lead to changes in hypertension, all right, high blood pressure levels, whatever you want to call it, but you get that natural production of nitric oxide. And just like some of the other foods that we talked about, that's why it's so important. That was nitric oxide, the nitrates as well. It's going to lead to the blood vessels to dilate, vasodilation. That's what that process is called. So again, garlic, one of your best choices. Great, Sonia. It's great to have you here. I hope you're able to learn a lot. If you missed anything, again, I'll always make sure I repost these. So if anyone missed anything, you'll be able to go back and listen. Because we have mentioned quite a few foods already, haven't we? We've kind of been going through quite a few of them. All right, especially, ones that are important. And we also talked about the important lifestyle changes. Again, we have to talk about lifestyle, being active, all right, 150 minutes of movement a week, maybe even some resistance training, and watching out for obesity or being overweight. Again, can be a touchy subject, but it's something that has to be brought up. If not, again, add all of these foods in there, but you're making it much harder on yourself to lower blood pressure if we're dealing with obesity or anything of that nature. And you're just leading to more and more chronic diseases that are going to affect blood pressure, such as diabetes, okay? Huge effect on blood pressure levels, heart health, cholesterol levels, things that aren't good for blood pressure, all right? Type 2 diabetes, all right? Horrible for overall heart health, horrible for blood pressure. So things of that nature. That's why I'm saying it has to be brought up. Hey, good afternoon, Gloria. Hope you're doing well. Thank you so much for joining us. Oh, great, Sonia. We've talked pretty much just about plant-based foods. So I think you get a lot out of this so far today. That's great to know. So again, guys, garlic, excellent for both systolic and diastolic blood pressure levels. All right. And again, very versatile. And the thing with garlic, that's why I love it so much when it comes to overall heart health and lowering and regulating blood pressure, is you don't have to eat it in large amounts. That's the amazing thing. All right. We can just have a clove a day or half a clove a day. You can just add it into a recipe, chop it up. All right. If you're not a big fan of garlic, chop it up nice and fine. Add it into any sort of recipe, stir fry. You can cook it with vegetables. I know a lot of people do that who aren't a big fan of garlic. It's a nice addition to stir fries like broccoli, spinach, all that great stuff. So garlic is one of the best and one of my favorites. All right, now let's talk about another one here. All right, this one maybe people haven't really thought much of. All right, we talked a little bit about nuts and seeds. Now, again, I usually talk a lot about almonds, walnuts. We already know that those are very, very healthy for us. But one of the best ones, all right, guys, is going to be pumpkin seeds. All right, I'm going to give you two. The first one, the seeds, you guys have heard me talk about and kind of sing the praises of pumpkin seeds when it comes to heart health a number of times. But I would be remiss if I didn't tell you about pumpkin seeds and their ability to lower and regulate blood pressure levels. So the first one you might know a little bit, but let's talk about why. All right, the why is a little bit different. We know that they're healthy, but why can they help lower blood pressure? The second one we haven't really talked so much about, and I'll give you that one in a minute. So stay tuned for that one because it's pretty interesting, and it's one of the favorites of most individuals that I know, and I don't often recommend it. All right, I usually, like I said, walnuts, almonds, Brazil nuts, what else? Hemp seeds, flax seeds, things like that. I get asked this question a lot, and today is its day. So let's kind of tease that one a little bit, but let's talk about pumpkin seeds first. All right, pumpkin seeds, amazing nutrition, so great and heart healthy micronutrients. They're a tremendous source. Remember, there's micronutrients that are great for regulating and lowering blood pressure levels. The most important ones being magnesium and potassium. And pumpkin seeds are one of the best, all right, seeds when it comes to magnesium and potassium. They're packed with both of those. Also, again, pumpkin seeds, we already know, tremendous micronutrients, but they contain an amino acid as well, and it's not citrulline. It's a little bit different. It's called arginine. All right, arginine. All right. Now, the reason why arginine is so important, all right, arginine is needed, all right, to create nitric oxide. So it has that special amino acid, all right, that's going to help naturally produce nitric oxide. And again, that's going to lead to blood vessel relaxation, all right, so dilation, relaxation, whatever we want to call it, all right, and then once we have that vasodilation through the process of nitric oxide being produced by the amino acid arginine, all right, that's going to help lead to a reduction of blood pressure, both systolic and diastolic, I believe, all right, and there's numerous studies out there that are showing this, all right, so again, I'm not handpicking ones, all right, I just look at the ones that are the most helpful, see if I can find some that, sort of back up the claims in some of these studies, and then those are the ones I prescribe, guys. So it's not like I'm handpicking ones that show pumpkins. All right, we know that arginine is needed for the production of nitric oxide. We know that pumpkin seeds are a great source of that amino acid. We also know that pumpkin seeds are a great source of magnesium and potassium. So pumpkin seeds are a great way for controlling blood pressure levels and lowering blood pressure levels, guys. All right. Again, it's going to help with blood vessel relaxation through the process of vasodilation, and again, reducing the risk of atherosclerosis, which is one of the risk factors when it comes to high blood pressure, guys, and especially heart disease. So pumpkin seeds, great choice. They're probably my top choice for seeds. All right. And again, they're just so nutrient dense. You don't have to eat a lot of them. And I wouldn't eat a lot of them, because if you are, then you're just increasing the amount of calories you're eating, which is going to affect weight. All right. And we don't want to be going into a surplus of calories, because if you're in a surplus of calories day after day, that's when you're going to be dealing with weight gain. All right. Which could be leading us down the road to possible obesity, which we don't want. We want to be at maintenance level, maintaining a healthy weight, or if we do need to lose weight, we want to be in a deficit of calories. Now, I think we kind of got it with pumpkin seeds. Very high in magnesium, very high in potassium, very heart healthy. All right, they're high in arginine, so the amino acid that's needed to create nitric oxide, which is very healthy for our blood vessels, which can correlate into a reduction and regulation of blood pressure levels. I'm going to give you guys just maybe 1 second if someone wants to guess a popular nut that I don't normally suggest, but what's maybe one nut out there that that's very, very, very popular that can help lower blood pressure? I'm just going to give you a second while I take just a sip of coffee here, guys. Yeah, it's not almonds and it's not walnuts. Those are the ones I'm always talking about, I feel like, especially when it comes to heart health. But today, a little bit different when we're talking specifically about blood pressure. Okay, this one's a tough one. So let's go over it together here, guys. All right, so I know a lot of people are fans. People know that almonds are healthy. We talk about almonds all the time. People know that walnuts are healthy, Brazil nuts. Again, we've gone over those a ton of times. But one of the best foods that, especially nuts, when it comes to decreasing blood pressure and lowering hypertension is pistachios, surprisingly. All right, again, now we want to make sure that we're eating pistachios in moderation, all right? Because again, they're high in fat content. All right. We don't want to be going into a surplus of calories and everything of that nature. All right. But again, very, very helpful when it comes to improving the health of our blood vessels. And you guys see a constant discussion on blood vessels. Nice guesses, guys. Pecans, cashews, those are great guesses because those are ones I don't say all the time. Now, does that mean pecans aren't healthy for our heart? Absolutely not. Or cashews. Just when it comes specifically to lowering blood pressure, pistachios are your best bet, guys. All right, as we've seen through studies. Okay, so they're able to reduce, restriction of the blood vessels. Remember, we don't want restriction. We want dilation. We want that vasodilation, so they're not working as hard, and it's not leading to a hardening of the arteries and blood vessels. Okay, so get unsalted, all right, unsalted pistachios, and keep it in moderation, guys. If you're not keeping it in moderation, it's going to have the exact opposite, all right? So we already know pistachios, through studies, can help to reduce blood pressure levels, especially people who are naturally stressed a lot, all right? They can have stress-reducing abilities as well. And again, I'll say it one more time, of course, almonds can also help just a little bit as well, but only if you're keeping the skin on, because that's where the antioxidants and a lot of the micronutrients are found. All right, so pistachios, guys. Now, lastly, things you're going to want to avoid. All right, you guys can probably name these ones. How many? I would keep it at 10, Gloria. Just like I would for almonds, I'd say like 10 pistachios. That's all you need. All right, they're high in fat, so you're going to be getting other fat sources throughout the day. So if you're eating 10 pistachios, you're already getting a good source of healthy fats. So 8 to 10, I would say, Gloria. And then, again, it depends on your calorie needs, but 8 to 10 is a pretty safe bet. Now, lastly, we'd be remiss if we didn't talk about foods we need to avoid. One, obviously, is sodium. Tons of studies on salt and its ability to increase blood pressure. So we want to reduce salt intake. And we also, I guess I should mention too, lowering your salt intake. So lowering sodium is going to have a significant ability to help reduce both systolic and diastolic blood pressure. When we're eating too much salt, that's when we really see an increase in blood pressure levels. The other one, guys, that you may want to stay away from, or at least keep in moderation, is alcohol, right? Things of that nature, if you're going to keep it in moderation. And then the other thing is sugar. Again, obesity rates, things like that. All right, all of these are devoid of any heart-friendly nutrients, like we mentioned before, potassium, magnesium, fiber, any of that stuff. Okay, so keep those out of the diet as much as you can, and put these foods in. And again, you don't have to add all of them, and you don't have to add all of them in one day. Eat them in moderation. Make sure that you keep that movement going, lifestyle changes, and then you guys are going to be doing a good job of lowering blood pressure. Unfortunately, we have to end the stream, the discussion for today, but it's been a great chat, guys. I hope you're able to get some. We went over a ton of different foods, all right, because some of them we made a nice umbrella. Like with berries, we went over 4 of them. We added watermelon and bananas to that. We talked about dark leafy green vegetables. We went over lifestyle stuff. We went over garlic, oatmeal, beets, all of those different things. All right, so there's a lot to add from and to choose from. So like I said, unfortunately, we have to end it a little bit earlier today, guys. I would love to chat a little bit more, but like I said, YouTube is not my main job. So I was happy that I'm able to get on here for over an hour. We still went fairly long today. All right, we went 65 minutes plus. So I hope you guys were able to get a lot out of today's discussion. I thought it was a very important one. Again, there's going to be a video going up on cayenne peppers, which again, cayenne peppers can help lower blood pressure. There's another one for you guys. Again, you don't need to eat it in large amounts. I would recommend not eating it in large amounts. But that's another one there for you guys. But thanks so much. I wish I could stay a little bit longer, but don't worry. We'll make sure we keep it nice and long on Sunday. Same time, around the same time. We'll keep it around 12-ish Eastern Standard Time. Thank you, Ronald. I really appreciate it. Gloria, my pleasure. Again, guys, if you missed some of the discussion at the beginning, I always repost these chat discussions up on the channel. That way you're able to listen to them. So if you did miss some of them at the beginning, I think those were some of the most important ones, especially with the dark leafy green vegetables, the beets, the berries, bananas, all that different stuff, talking about the lifestyle stuff that we're going to want to include as well, because we can't just add foods and not worry about lifestyle. Lifestyle is very important, just like it is with cholesterol and all that different stuff. So thanks so much, guys. Yes, thank you, Ronald. Remember to give a thumbs up. My pleasure, Laia. I appreciate it. Thank you, Gloria. Thank you, Ronald. Thank you, Sonia. Everyone else who was in here. Mac, Marilyn. Appreciate you all. Lucy, Zeus. Sorry, I can't go up any further than that, but I think Teresa was in here. Thank you so much, guys. I look forward to our discussion on Sunday. Again, 12 Eastern Standard Time. Well, I'm so happy to hear that, Gloria. I'm happy that you enjoyed it so much. I did too. So thank you so much, guys. Unfortunately, I have to run for now, but we will be on Sunday, 12 Eastern Standard Time. Look forward to it, and keep looking out for those daily videos, guys. Those won't be stopping either. So thanks so much. I appreciate you all. Love, light. Let's start from the beginning. I'm sharing this too. Wow, I really appreciate that, love, light. Thank you so much. I hope that you enjoy the discussion when you go back and listen to it. And thanks so much for sharing. I appreciate that. So everyone have a safe and great Wednesday. All right. Have a safe rest of your week, and I will talk to you live on Sunday. My pleasure, Lucy. Take care. All right, guys. We'll talk to you then. Thank you so much. Bye.